This is revision gynecomastia surgery with excision of tissue. This patient came from the Midwest, but had originally had surgery somewhere on the East Coast by another surgeon about 5 years ago. And I think in that surgery, he just had excision done, no liposuction. You can see he's in pretty good shape, but what he's really unhappy about is he doesn't think he had as much tissue removed as he wanted or hoped for. And really, revisions, I do a lot of revision gynecomastia surgery, and they fall into two general categories. There are people who are over-resected and people who are under-resected. And they both present their own unique challenges. And I'm going to show you already here, he was under-resected, and I've done my markings. And one thing straight away, if you've watched my videos in the past, when I do my markings of the breast tissue, I'm very careful about pinching and finding all the borders, and it usually ends up being kind of like an oval shape. But you can see in this case, especially on this left side, it kind of looks like a kidney bean, and that's because the prior surgeon removed some tissue in certain areas but didn't remove enough in other areas. So I have to go and make sure everything is much more uniform. But I still adhere to the same principles I always do in my surgeries, and the key thing being the pinch test. His pinch test here is only this thick, but when I go here, you can see it's a couple times